the Expert segment. We're taking your plastic surgery questions today. As you might imagine, summer is a pretty popular time of year to have work done. I guess a lot of folks want to look good on the beach.
Yeah, I think a lot of people do that. Well, joining us this morning, Dr. Stephen Davis. Good morning to you, doctor.
Good morning.
You are in private practice in Cherry Hill, New Jersey. Are you prepared to answer just about anything from our viewers this morning?
Absolutely. Anything you guys can drum up, I'm ready to answer.
You might regret that.
All right, well, let's get things started. First, just to give us all some perspective here, what is the most popular procedure people are having done at this time of year, and then why?
Well, the #1 procedure is a breast augmentation, and I'll tell you the #1 reason why is because you can go to the beach almost right after having it done. You look great in a bikini or whatever you choose to wear as a bathing suit, and you just sit there and relax. So I really do think right now especially.
And we're hearing about these like lunchtime breast augmentations.
Well, you know what? It's not that it's a lunchtime breast augmentation in the fact that you really need more than just the lunchtime to have the surgery, but you're going to need about 5 days to a week to recover, and there's really not a lot of things to do except just look really good sitting by a pool or by a beach, so you could do that.
All right, it's our viewers' turn now. So if any questions out there from our viewers for Dr. Stephen Davis, go to myfoxphilly.com. He's going to be here all morning long. Click on the Good Day tab for our Ask the Expert section. And Dr. Davis will check back with you in just a few minutes for some more questions. Are you ready, sir?
Absolutely.
All right, here we go.
All right.
We're getting the answers to all of your plastic surgery questions this morning on Good Day. If you have any question about plastic surgery, costs, certain procedures, the risks involved, just click on the Ask the Expert tab of the Good Day page when you go to myfoxphilly.com to submit your question, and we'll answer it right here on the show. We'll be right back. Welcome back to the show. It's now 7:56. It's time to check in with Dr. Stephen Davis, who's answering your plastic surgery questions live this morning for today's Ask the Expert segment.
Dr. Davis, a viewer by the name of Dana is asking a pretty interesting question this morning. She says there's an infomercial that comes on television in which a woman is pushing an exercise product, and she says it's so obvious that this woman has had a lot of plastic surgery as nothing moves on her except her mouth. So Dana wants to know, what's the point of getting plastic surgery if it doesn't look natural? Doc?
Wow, that really gets to the heart of plastic surgery in general. And the beauty of that question, Dana, is that plastic surgery is an art form. And although you may be able to teach someone how to do the actual procedure, that doesn't necessarily mean that you're going to get this beautiful natural result. And it's very obvious in those kinds of things where you see someone that really looks like almost like a mannequin.
Yeah.
Right.
And unfortunately, facelifts and nowadays Botox injections and other kinds of things like Restylane or Juvederm injections are done by a lot of different kinds of people that really don't have, let's say, the art of plastic surgery. And it's a great question. But the only other caveat to that, Dana, is that sometimes patients actually come in asking for a certain look. And it is up to the plastic surgeon to try to discuss with them where they're going with that look or what they really want, so that ultimately if you do achieve a look that does look like that, I'm not so sure it's a great look, but that may be what they were striving for.
Interesting. All righty. Well, I could talk about that one all day. We have another one from Carol, a question. She's from Philadelphia. She wants to know how much an eye tuck costs and how long it takes for the eye area to heal after the procedure.
Well, I'm assuming that she's talking about the upper lid, because you can actually do an upper lid and a lower eyelid type of surgery. It takes probably about a good week for both of them to really come back to what I would say is ready to go back to work. But it is a very elegant procedure, and many times, as everyone knows, the eye is like the window to the soul, and many times patients come in and say that they are looking older basically because they've developed extra skin or puffy bags around the eyes. And that's a procedure that is also rather quick to do and can be back, you know, in no time.
All right, well, we're going to have many more questions for you. Dr. Stephen Davis, who's in private practice in Cherry Hill, New Jersey. Simply go to myfoxphilly.com, click on the Good Day tab, and look for our Ask the Expert section, and we'll check back in with him in a few minutes.
All right. When do you, or I guess any other time, you have a plastic surgeon right there just to answer your questions, or a doctor, any kind of doctor.
And it's free.
And one last time with Dr. Stephen Davis.
Yeah, he's a plastic surgeon in Cherry Hill, New Jersey. He's been here all morning long answering your questions.
Thank you so much. Well, okay, now we have a question from Jean.
Okay.
Jean says she has excess skin from pregnancy. She wants to know if she's a good candidate for a tummy tuck.
Well, Gene, one of the first prerequisites is to have this excess skin, and if you have that from the pregnancies, the operation's fantastic because what it does, it allows us to take away the excess skin and fat, and at the same time tighten the abdominal musculature that may have weakened over the multiple pregnancies. So, you know, if medically you're okay, it sounds like you're a good candidate for something like that.
All righty. Well, we have several more questions, so hopefully we can get those answered. Even if it's not live on the show, maybe we can reply to some of their emails. Dr. Stephen Davis, thank you so much for coming in this morning.
Lost that.
We might have been having trouble hearing us there, but he's going to be answering questions online as well. But let's